Okay, welcome to True Health Tuesdays. Today it's the thoracic spine. Now that doesn't sound really like, wow, the thoracic spine, you're kidding. No, when you look at it, it's the underutilized source. I mean, we talk about the pelvis as being like amazing and underappreciated. And then we talk about the neck as being underappreciated. We need to spend about 4 months on just the thoracic cage to understand it, but we don't have that time. So when we look at the thoracic area, I'm going to show you the actual off button, how stress kills, the mechanism of how stress kills, how important the rib cage is, how important it is to maintain the structure above the neck area and the structure below the low back, and how important it is. We're going to cover a few things. We're going to cover the anatomy of what it's built like. We're going to cover the neurology or the nervous system in and around it. And this is super huge. Some of the physiology, some of the pathology, and some of the solutions. And I can only say some of them because you got to figure there's about 3 different classes in human dissection that I would teach just in this area. And these classes were about 3 months long. So there's just going to be a rough overview. When we look at the bones, and this is hugely important, the bones have cells that live on them called osteoblasts. They build it up. The cells that tear down the bone called osteoclasts. So you have this build up and tear down process. But also, when you look at it, the way the structure is from the side, you've got this balance. This 15-pound bowling ball of a head is balanced over the pelvis, and that puts equal force loading on this. When you look at it from the front, it should be straight up and down. And the rib cage area, it's even more important because it has 12 ribs on either side designed for protection. Has anyone ever seen like one of those strongmen put a concrete block on his chest and hit with a sledgehammer? It's phenomenally strong. But now what happens when you see something where the shoulders start rounding over? Why does that happen? I'm going to tell you. See what happens, this area here, it's a tough balance between strength and flexibility. You've got a nervous system that comes from the brain down. Now the spinal cord is not a bundle of nerves. It's a long tubular brain. It has its own function. Now you can see the way this spinal column is. You've got a bone in front, and that's called the vertebral body. You've got this fin-like protection on the back, and that's for a lot of muscle attachments. But all the nerves come out of the back half. So if you can see how this bone is, all the nerves are coming out of the back half of it. So the weight is placed on the discs and the bones. Now, let's say that since there's so much force loading on these discs, there's really a horrible blood supply to them. Because if you figure the disc down here, if I was to do this, I'm putting maybe 100 to 200 pounds of pressure on that disc. And this is normal. Okay, I mean, I figure I lift people all day long. I put a lot more force on my discs. So how come my discs aren't breaking down? Because they don't have a good blood supply. They get their nutrients through movement. And this is hugely important. So if the body moves, then the fluid inside of the tissue gets into that disc and can fill up the tissue or fill up the disc with fluid. Also, so if you have motion or force loading on those discs, the bones get stronger. Now this is interesting. If you had, say, a broken bone and put it in a cast, and what you're going to see is the bone will heal, but all the bone tissue around it gets thinner. Because if you don't use it, those osteoclasts, or what the body builds up and tears down, it's not going to need to build it up. So let's say that you have a sedentary lifestyle where you're not moving those bones, you're not moving that rib cage area. You're, an office worker, a truck driver, or you're a couch potato. You're not getting a lot of motion, so those discs get small because they're not getting the nutrients. And if the disc gets small, it's going to pinch the nerve. So watch what happens. What's the benefit of rounding over the shoulders? Want to see what happens? When I round this over, what happens to those nerve holes? Say it gets bigger.
It gets bigger.
It gets bigger. It gets a lot bigger. Okay, it gets a lot bigger. I'll do this for a YouTube camera. It gets bigger.
Bigger.
No, just kidding. No, so what that means is when you see somebody with that rounded over shoulder posture, that's disc dehydration. That means they're not moving it correctly. So that means unhealthy toxic blood or not enough movement. Does that make sense? And so that's not old age. That's the body adapting to deficient and toxic circumstances because they're not getting appropriate nutrients or movement to the bone. And so it's rounding over like that to keep the body alive, to keep the nervous system restored. Does that make sense? I know, just brilliant. Now, the difference between pathology, and this is when some bones can just fracture. Okay, and this is like cancer. Okay, and people that have chemotherapy, you're going to see a lot. Chemotherapy tends to spread cancers. Okay, I know if you're not up on normal health in your program by the TV, you're going to think that chemotherapy actually solves cancer. Well, no, it spreads cancer. Okay, except in 2% of the time. So only 98% of the time it's bad. Well, what happens if the body isn't moving correctly, the body's going to absorb that bone tissue, but it's going to absorb it through the front portion of this. Okay, so it's going to absorb it to see if you're not moving, you don't require the calcium and minerals inside of this bone, so the body's going to take it up. Or let's say that you're doing something crazy, like taking antacids. Do you know what an antacid does? It causes calcium and magnesium and iron deficiency. So your body needs those. Where's it going to get it? From the bank. The bone bank. So it's going to go up there and withdraw it. Let's say that your body is hyperkyphotic or you're starting to lose the nutrients. Let's say you need higher blood pressure. In crazy world, they'll give you a high blood pressure medication or literally slow your heart down. Does that help blood or does that slow blood down? Slows it down. I know. That's really dumb. That's not smart. Okay. So what happens is if you're not moving it, your body's going to literally resorb that bone tissue, but it's going to resorb it from the front, away from the nerve. So instead of beautiful square bones, you're going to start to see them become wedge-shaped. And some of them, they'll even fracture on the front portion of it, not the back half. The back half is where that nerve hole comes out. So the body does everything to maintain the integrity of the nervous system, even in toxic circumstances. I mean, don't you get goosebumps understanding that? That no matter what your body goes through, it's intelligent. It's going to even cause osteoporosis intelligently. So when somebody says, hey, what do we do for osteoporosis? Fix the toxic and deficient circumstance, and your body's going to regenerate the bones healthy. Does that make more sense? Because it's true. I mean, when we look at how the body is designed, this gal here is a 90-plus-year-old yoga instructor. Her bones are probably thicker than mine. Okay, so we have to start looking at this. Now this is, I changed the name, but the age is appropriate. This is her spine standing up straight. That means when a normal spine is straight up, hers is off to the side like this. Does that look comfortable or uncomfortable? Extremely uncomfortable. In fact, you can't see the side view because I didn't take the side view. This is a normal side view. Her side view was like this. She came in walking almost with a cane like this. Now, when I took her x-rays, this is about 4 years into care. This is about, I think 11 years into care. She had 11 fractures. Now, I see fractures inside of the bones all the time because of our medicated society. How many people are taking antacids? You know, how many people are taking blood pressure medications or antidepressants or sedentary lifestyle? You're going to see a lot of them if you shoot an x-rays. Okay, so she had 11, there's only 12 vertebrae in the thoracic area. 11 of hers were fractured. And how do they fracture if you're toxic and deficient? They fracture in the front, crushing that front bone, causing her bone to get hyperkyphotic. Okay, and that kyphosis is that rounding over. So her body was trying to protect her nervous system. Well, what's amazing is the doctor that caused the fractures, the doctor that caused the fractures. Now, which doctor do you think caused the fractures? Do you think it's the medical doctor? Yeah, because what did he prescribe? She had indigestion, they gave her antacids. She had higher blood pressure because her body wasn't working right. They gave her a blood pressure medication. She had massive amounts of inflammation, so her body tried to produce cortisol, which is an anti-inflammatory. You need cholesterol in order to produce that natural anti-inflammatory cortisol. So her cholesterol went up. So what did they give her? Cholesterol medication. Okay, she's not active or outside, so is she happy or sad? Prozac. Okay, so if she's not sleeping good because her muscles are tight all the time, so what do they give her? Ambien. Okay, good. So we're talking, I think, what was it? 5 medications she was on. Okay, and that caused more and more toxic deficient circumstances. What did the doctor, after she had her 11th fracture, say when she said, should I go to the chiropractor? What did he say?
No.
Oh, God, no. They'll break your bones. Hell, he's better at it than I am. He broke 11 of them. So she came to me, and we got her adjusted, but what we're doing, we're causing an inflammatory response. We're actually causing inflammation at the disc so the body regenerates. And then what do we do with her digestion? Got it to work better. I mean, that's her before and after. You can see it went from a 22 degree or 21 degree bend to an 11 degree bend in the rib cage area. That's huge. Now, when we look at this, the most frustrating thing that we have to have patients unlearn is about muscles. Okay? Now, you've got a tremendous amount of muscles coming around this rib cage area. And you've got muscles that overlap. You've got a deep, a middle, a superficial layer. There are multiple layers of muscles that come around. Now, what's wild is most of these muscles you don't have conscious control over. You do have a tremendous structure that comes off of here called the shoulder. Now, we can't go into the shoulder a lot. I'm going to do an entire health talk on the shoulder, okay? But just understand that we've got a rib cage here that's got 12 ribs on either side. And then you've got this incredibly mobile crane, okay? So for it to go away from here and can lift a tremendous weight, okay, the entire rib cage tightens up. Now the shoulder has 18 muscles that glide it and slide it up and down the rib cage area. One bony attachment. Just one. It's the clavicle. So this thing is incredibly mobile and strong, but it's designed, you have to have that stability of the rib cage. This is why moving that shoulder and the muscle girdle that's attached to it, any muscles that pull on this rib cage are actually going to make the rib cage stronger. It's kind of neat. Now, the difference between postural and phasic muscles. Now, this is one of the slides that I took out when I teach how to correct scoliosis. Yes, you have to reteach doctors anatomy and physiology. Okay, even chiropractors who have about triple the anatomy and physiology, because you got to keep learning it. No matter how many times you learn this stuff, you got to keep until you own it. The muscles that run down either side of the spine are called postural muscles, which means you can't strengthen them. They increase in tone under proprioception. Proprioception is your body's position in space. Now, have you ever been sailing? Okay, anybody in here ever get seasick? Okay, good. You won't now that you're getting adjusted, okay? Because what happens is, here, when you're sailing, and my boat sails best when it's 15 degrees, so that means everything inside of the boat is like this, okay? The horizon is still like this. But your brain is telling you that your whole world is at an angle. Your inner ear is telling you that it's like this. Okay, so you have that proprioception, but when you're in this position, all of these muscles on the outside are firing to keep you level. So you don't have conscious control of this. That head is balanced. For every 1 inch that heads forward, the pressure on the discs doubles. So what do you think is going to happen if your head's this far forward? What do you think is going to happen to these shoulder muscles? They're going to fire up like crazy to reposition them. The most frustrating thing is an office worker or somebody with a dehydration or a hyperkyphotic spine. They're going to say, what do you think the shoulders are like? Tight or loose? Tight. All the time. And now who would they go to for a tight muscle? Physical therapist, chiropractor, MD, all three of them. Why not? What the heck? They got good insurance. Okay. What's the MD going to do for tight muscles? Muscle relaxant, good job. Anti-inflammatory and pain reliever too, why not? They got good insurance. Okay, so they get 3 drugs. They go to a physical therapist, what's he going to do? Ultrasound, muscle stem, maybe a good shoulder stretch, okay? And that's going to relax those muscles. Go to a chiropractor that's not a corrective chiropractor, what's he going to do? He's going to loosen up, massage those muscles. If you relax any one of these 3 people here, which way is that head going to fall? Further forward. It's insane. What a real doctor is going to do is identify why the muscles are tight, and then you restore the curve in the neck, relaxing the muscles. That makes a lot more sense. It really does. But you have to have somebody, because this right here is a reversal of the natural curve in the neck. That means she injured a ligament and her head's forward. Worst thing you can do is massage that. Here's a patient that came in 2 weeks ago. His ear is supposed to be, and shoulder is supposed to be on that green line. Does he have forward head carriage? Absolutely he does. He would go to a chiropractor and a massage therapist, and guess what he would say? He said, by God, I got to catch the train. No, no. That was a ringer. Okay. No, he would say, I would go get adjusted or treated, because he wouldn't get adjusted, he would get massaged. By the time he got to the car, his shoulders were tight. Have you ever heard that before? Drives me crazy. No, you got to get somebody that goes in there and adjusts that. And this again, look for why the muscles are tight. Look for why the muscles are tight. Does that make more sense? Yeah. Do not relax a muscle unless you know why it's tight. Now this is super important, because if you bend a spine off like this, the muscles on the outside, and this has to do with scoliosis, increase in tone. They increase in tone. That means they're trying to shorten or to straighten up that spine. So the body doesn't do anything ever. It doesn't do anything ever that's not intelligent. Okay, it always responds intelligently. And this is a patient that just came in this week from Texas. You can see, not only is the head thrown forward nearly 3 inches, but that's a reverse curve. Now when you start looking at this, you think, wait a second, with that head forward, does that mean that the arms are going to have a problem? Yes or yes? Maybe the heart too, because we got the nerve for the diaphragm that comes out of the base there, so maybe long-term chronic heart problems. Yeah, long-term toxic blood issues. I mean, all this stuff, when we start looking at it, we can start fitting those pieces together, and it's like looking at a map. So you know how to fix this. Now, remember a couple of weeks ago we were talking about the neck and the sensor being in the neck, how you've got the heart down here and it comes up in the carotid and it splits. One goes on the inside to supply the brain, one goes on the outside. At that junction, there's 2 sensors, just like NASA. Okay, and the sensors check carbon dioxide levels and blood pressure levels. They're called a chemoreceptor and a baroreceptor. So when those sensors sense carbon dioxide levels go high, it increases the heart rate to get more oxygen going to the lungs, to get rid of the carbon dioxide. If carbon dioxide levels are low, it slows down the heart in order to balance that pH, to get the carbon dioxide levels back up. I mean, because you know that you can breathe into a bag and you're eventually going to pass out. Okay, and this right here, those sensors are intimately connected to the heart, lungs, and diaphragm. Okay, so, and I want you to just remember that, because we also want to look at the nervous system. And I know we're on a breakneck trip going through the thoracic spine, but when we look at the nervous system, it's not a collection of extension cords. And this, I wish doctors really appreciated this too. There's an area inside of this area that you can actually open up, dissect, cut, and it looks just like this. That's called a laminectomy, and where you can expose the spine, and you can actually take a cross-section and identify the area of the spinal cord here is different than the spinal cord here. In this area, in the thoracic area, it has a little protrusion on the outside right here called the lateral horn. And that's the sympathetic nervous system. It actually is the autonomic nervous system. It's the fight or flight nervous system. And it's an area inside of that long tubular brain called the spinal cord. And I mean, this just, it thrills me to no end, because you got to figure, if you have any subluxations or bend in there, does that affect the autonomic nervous system? It would have to. Obviously, it's going to change information going up to the brain, but it's going to massively affect that autonomic nervous system. And if that's stimulated or out of balance, heart rate's going to be what? Up. You're being chased by a tiger. So blood supply to the gut's going to be shut down. So you're going to start thinking, man, sleep disorders. So all of that comes if there's an impingement or alteration in the autonomic nervous system. I mean, it's just, so any doctor that's watching this, don't give a diagnosis. That's foolish. give an understanding for why the body is responding in that intelligent fashion. Okay, so it takes a little bit more detective work. Stress kills. How? Don't you love that? I love putting people on the spot. I would be such a good turkey, like mean guy. Okay. Describe how stress kills. Everybody knows that, right? Everybody has heard it. Do you want me to tell you? Mm-hmm. I'm going to actually tell you how stress kills. Okay, now this is important because when we look at this, the nerve supply to the heart is the top of the rib cage, T1 through T4. That is the sympathetic nerve supply to the heart. Now we all know that the diaphragm is down here. Now on the left-hand side there's the heart. On the right-hand side there's the liver. Now if you irritate the diaphragm on the left-hand side, it tightens up this left muscle over here called the trapezius. That's why when somebody has a heart attack, they grab their left arm. You know, you all see it in the movies. Okay, left jaw pain, left everything. That's because this muscle tightens up if you irritate the left-hand side. Well, same thing with the right-hand side. So if the liver, and this is why what you have to do as a doctor, it's called DDX, or differential diagnosis. Somebody comes in with right shoulder pain, you have to say, well, might be from the neck, might be from the liver. Okay, I know. It's like, what happens if the left shoulder, well, the left shoulder could be from the neck, could be a direct trauma from the shoulder, or it could be the heart. So you have to look at this stuff, and it's called DDX. But what that means is the liver, which is located over here on the right side, there's a patient facing us, and you can see that their spine is massively bent over to the side. Whoops, here. Bent over to the side like that. Right, and the apex is T1 through T4. That's the nerve supply to the heart. Okay, well what happens is, and this is when we see a rotation in that area, that's the scariest thing you could possibly imagine. This is how stress kills. See, that liver has to process these stress hormones. And so we're talking cortisol, adrenaline, noradrenaline. I mean, all of those hormones it has to process more and more. And this is the off button, the natural brilliant off button that will turn your heart off. Because eventually it starts pulling and pulling and pulling. The center of that trapezius, okay, is right at the nerve supply to the heart, so it pulls it over more and more and more and more. Eventually, bam, it fires a sympathetic charge down to the heart, putting the heart in ventricular fibrillation, stopping the heart. I could show you 100 people with pacemakers, and this is a patient that came in a few years earlier, did not get care. He decided to go to the medical world, okay, which the medical world doesn't, well, I shouldn't say doesn't correct it, because these here are wires inside of his chest designed to go in and override the natural nerve conductivity of the heart. This is called a pacemaker and defibrillator unit. So, I mean, literally, I could show you X-ray after X-ray after X-ray of people with defibrillators and pacemakers. It's all in that area. Yeah, but now, and again, it's a slam on our society, not on intellect, because you've got a profession that's smart enough to knock somebody out, take a wire, put it through this venous system with a little fork on the end, like a spear, and jam it into the floor of the right ventricle, and then the heart's going to close over this wire system, okay, as long as the person's alive, and then they put a battery underneath the skin, and then they fold the skin over and sew it back up. And you replace the battery or recharge it or something. Okay, now then they bring the person back alive. And I'm going, wow, that's really technical. It's not really smart, because it'd be a lot smarter to look at the natural nerve supply to the heart. Doesn't that make more sense? It does to me as well. And so when we look at this, we have to appreciate what the nervous system is. Like you'll see advertisements for the shingles shot, which is barbaric. But it comes along a dermatome, okay, or one nerve root. That's because the herpes zoster virus actually lives at the nerve root ganglion, and it appears on the nerve. So when we look at it, if you have a pinched nerve in the back, and I've had so many people that have had a pinched nerve in the back up here, and it comes around to the front. Ready? Ready. Backing up now. Through the miracle of editing, Dr. DeWitt will take care of that. Okay, so when we look at dermatomes, or the nervous system, each segment here comes out and supplies it. This is why when somebody has like a pain in the chest, it may be mimicked by the pain in the back. If they got pain over the nipple area, that's usually about T4. If they got pain in the belly button or the sternum. So we have to double check it where, because this area doesn't really cause discomfort or problems unless there's a direct trauma. It typically has to do with the nerve pressure. This is a perfect example. This is a patient that comes in, okay, and I think at the time he was 56 years old. You can see a massive right rotation at T1 through T4. Now, did he have high blood pressure? Yes or yes? Yes. Do you think he had possible cardiac arrhythmias and difficulty in breathing, maybe arm pain?
Possibly.
Yeah, possibly. You know, we could just, because you can read a map. I'm just showing you how to read a map. This is an x-ray. You know the nervous system now. Okay, so now I said, buddy, have you had cardiac arrhythmias? He said, yeah. My doctor's thinking about doing a pacemaker. And I said, well, okay, I could see you're taking the blood pressure and the cholesterol drug and the antacid and the sleep medication. How about we fix it? Bam! Okay, wait, did I do that too fast? Ready? Bam! Wow. Thank you. That's the reaction I was looking for. I really appreciate the one person that said, wow. That's a little late, but thanks anyway. Okay, so when you look at this, you're thinking, wait a second. We're actually appreciating that the body doesn't do anything not intelligent. So this high blood pressure, cardiac arrhythmias is the body screaming, hey, we got a problem here. Okay, the red light on the dashboard is flashing on this man. Okay, and in order for him to have a longer, healthier life, it doesn't mean he needs more and more and more medications. He needs somebody to listen to his body system. This is a scoliosis, and this is out of the scoliosis class that I teach doctors. What I want to do is, we've got hours on scoliosis correction. I just want to show you a little snippet for how a doctor could diagnose whether it can be corrected. This is a person standing up. She has a 25-degree bend in the spine. Now, let's just talk common sense. We're going to see if this bends. So we take it and we bend it off to the side. Wait, why don't I bend it the right way? Okay. Yeah, I'm not dyslexic. Okay. So when you bend it off to the side, if it doesn't change, you can't change it. If you bend it off to the side and it does change, you can. Okay, does that make sense? And see, when you're bending it off to the side, and this is what I tell the doctors, we're not changing the nerves, we're not changing the muscles, we're not changing the discs or the ligaments. All those structures we can change, but over time. What we're doing here, we're just finding out the limit of the structures involved. Okay? Now, could this be done at any age? Yes or yes? Mm-hmm. Yeah, absolutely. Yeah, so this was her post-X-ray. She went from 24 down to 15. So she surpassed her minimum because she went from 24, she bent down to 18, so 18 degrees was her minimum. We surpassed that, she got down to 15. So guess what we do at 15? Do another stress X-ray. Yeah, oh good, so it drops down to 12. So we can actually reduce this down to 12 degrees. I know, isn't that cool? Okay, here's a gal too, Lori. I changed the name. No, it's not my sister. Yeah. What's interesting, this gal had a stair chair. She couldn't walk upstairs. And, you know, you're talking multiple medications, you know, foot problems, bunions, everything else. And this is her 37 degrees. She can bend down to 14 degrees. After about 9 months, she was down to 27 degrees. So that's 68 years old, you know, so it's any age. So her ultimate goal is going to be to get lower and get healthier. But I should tell you that she went from 9 medications down to 3. And I'm still pissed off at the 3 because she doesn't really need them. Okay, but they've got her brainwashed into thinking that she needs the cholesterol and the blood pressure drugs. So when we look at the organs on the diaphragm is hugely important. Just know that all the organs, the heart and the lung, and it's designed for protection. You got the diaphragm on the bottom, you got the neck on the top. So all of that is intimately linked to the health of the structures. On the diaphragm, and the diaphragm is a muscle. Okay, if the muscle doesn't have integrity, the holes that go through that muscle are going to get larger. Okay, and I know it just sounds basic, but you've got a breathing muscle. When you breathe, you go. So this muscle is always flexing every time you breathe. Okay, about 16, 17 times a minute. So, a lot. Now you've got a hole that brings a vein or an artery down and a vein back up, and a hole for a food tube called the esophagus. And then you've got some holes in the back for muscles to pass through. But what maintains the integrity of a nerve? Say blood supply or nerve supply? Blood supply and nerve supply. Blood supply and nerve supply. Oh my God, what an educated group. Yes, okay. So now where's the nerve that supplies the diaphragm? I told you this 3 weeks ago. Did you remember it?
Yes.
Okay, good. It's the mnemonic C3, C4, C5 keeps you alive. C3, C4, C5 keeps you alive. That means the nerve that supplies the diaphragm comes out of the base of the neck and it goes right down there and supplies it. So if you have a neck like this, do you have good diaphragmatic function? No freaking way. Okay? So people with poor diaphragmatic function, or let's say you lose the integrity of that. You've got the stomach on the bottom here. If you lose the integrity of the muscle, part of that stomach can come up, and that's the fundus, or the hiatus of the fundus part of the stomach. So it's called a hiatal hernia, where it comes up inside of the lung tissue. This way, when somebody breathes and that muscle tightens up around that stomach, you get incredible pain. And what do they say? Oh, I can't take a deep breath, so my doctor gave me some antacids. Okay, I know, but I mean, it's basic anatomy. You should know. Well, if you got a hiatal hernia, or the fundus of the stomach is poking up, okay, inside of the diaphragm, you got to know that the diaphragm's lost integrity. Where's the nerve of the diaphragm? In the base of the neck. Also, the insertion or the origin of that diaphragm is all in the rib cage and the spine. It just makes sense. You don't fix this, and of course, there is a soft tissue adjustment where we actually grab that stomach and pull it down, but you also got to take care of the base of the rib cage. You got to take care of the neck in order to correct it. How often do we correct this? 100% of the time. Yeah, because we look at the problem. Now you're going to see a lot of people say stuff about the ribs and rib heads. Well, let me tell you, the rib comes around like this, passes by the transverse process as part of the rib cage here, and hits the front of vertebral body. Now that's where a rib actually goes. Now on top of this, there's about 2.5 inches of muscle. So I can't tell you how many people have said, oh yeah, I can feel a rib head out. I'm going, good God, that must be painful. Yeah. No, because the head of the rib is actually touching the vertebral body. It's way down here. So you can never feel a rib head. What you can feel is an increased tone of the muscles on either side. You can feel a distortion of that rib cage that's going to pop out one side. You can feel an increase in tone of the muscles, but you can never feel a rib head. Does that make sense?
The notch, yes.
The notch is way up front, so you're feeling just the increased tone or the response of the body. Okay, so, and I know I'm going to get a lot of comments on that one. No, I can feel rib heads. Yeah, maybe on a cadaver. Okay. And what we do a lot, and you're not going to see a lot of exercise pamphlets on this, but when you have a distortion of this, what we'll use is the scapula to actually derotate this out, to have pressure there, just like a dentist would reshape teeth. Now, I'm not going to concentrate a lot on the exercises, but it's basically taking care of the neck, getting mobility of the rib cage area, correcting any problem. But this is one good static exercise where a person is using that rib cage to distort it, using that scapula to distort it back to midline. And here again, I mean, Henry, 63 years old, high blood pressure, cardiac disorders, and what we're looking at is a 5 degree bend down to 3 degrees. So it only reduced 3 degrees, but it had such a massive change. So I mean, he had a 5 degree bend in the rib cage area, but it was causing those nerves to cause the heart to not function correctly, the cholesterol to go up because it's an anti-inflammatory, or actually is the precursor to the best anti-inflammatory you got. It's just, I mean, pay attention to yourself and listen to what your body's telling you. There isn't any disease. There's a deficiency or toxicity, and then the intelligent response to the body. It just makes so much more sense. I mean, when people say, well, Doc, I had to take the Tylenol. No, you didn't. If you have that stuff in your cupboard, take it to the poison control center and let them deal with it appropriately. You know, they have the toxic waste at Rainbow Disposal over here every Saturday. Bring them those anti-inflammatories and they'll dispose of them safely along with the other toxins. This right here, vegetables, turmeric, plant products, bromelain from pineapple. I mean, there's the omega-3s. There's a ton of natural anti-inflammatories. Here's another gal, and we're looking at a massive bend in the rib cage area down. And same thing, 5 medication. The rib cage area, since you're affecting the autonomics, you're causing that sympathetic fight or flight. Everyone's going to be misdiagnosed with cardiac arrhythmias, high blood pressure, digestive disorders. If the diaphragm's weak, you know, I mean, it's just, can you see this? Yeah. So that was the whirlwind trip through. You know, it's like the Disney movie where they take the pill and it was the ship and they travel through. That was a whirlwind trip through the thoracic cage. So this is what you really need. You need healthy nerve supply. That's it. And if the nerves are impinged, the body's going to respond in some type of intelligent fashion. If it's in a fight or flight because that body's under stress, it's going to give you those appropriate responses. You don't drug them. You need regular exercise, and that's to move, because the way that you fill these joints up with fluid is through movement. I mean, we prescribe the simplest of exercises where we have a patient turn to one side and turn to the other side. And then there's specific ones that are going to rotate or de-rotate out the spine. That's why it's really hard to say this one exercise for everybody, because not everybody's the same. It'd be a lot easier if they were. Proper nutrition. This means plant-based. If man makes it, you don't eat it. Sufficient rest. This means you've got to rest, but without the TV on, and prayer and meditation. It's absolutely essential. Now, all of these slides, all this data, all our handouts, everything is available on the owner's guide. 7 days for free. Unless you're a current patient, you know, even you're from England or Virginia, Texas. Anybody from California? Oh, Sacramento. Huntington Beach. Oh my God, a local. I didn't know they were here. Even free for you, sister. Okay, so now next week is going to be fun. We're going to talk about solar radiation management. Okay, that's how you explain it to somebody who doesn't know about chemtrails, because if you say, we're going to talk about chemtrails, they're going to think, okay, we're all going to bring our aluminum and put it on our foreheads. You know, no, it's not a conspiracy theory. Okay, we're going to talk about what's actually going on. You can look outside and see it. Okay, and that's going to be really interesting. So thank you very much.